Kommt ja noch. Science Slam. Er macht seinen PhD gerade an der Universität Heidelberg und an der Uniklinik. Also auch er kann euch vielleicht nachher noch irgendwie ein bisschen beraten. Und ja, es geht auch ein bisschen um Liebe, liebe Leute. Macht doch mal einen großen Applaus für den letzten Start am heutigen Abend für Lalith Sharan.
So Heidelberg, nice to be here. Had the shortest commute of all, so I'm glad. A little bit more about myself. So I'm a computer scientist at the University Hospital. You know that one friend in every group who everybody goes to for relationship advice? That is me. And I know some of you here really need relationship advice, so I thought I'll put together what I've learned in the last years and give you some notes. And those who don't want to hear it, you don't have a choice. So let's move on. So first, not all heartache is created equal, right? Let's understand where it comes from. I have a very scientific graph for you. So on the x-axis, you have the prevalence, how often it happens. And on the y-axis, how bad it is. And of course, on this side, you have stuff like crush is dating someone else, or you get ghosted. And on all the way to this side, you have things like she broke up with you 6 months ago, but is celebrating first year with someone. It doesn't happen to a lot of people, but when it does, it really hurts, you know? So these are, and here's an actual heart attack. And here's a breakup. Of course, happens to more people than a heart attack, but hopefully not as severe. And here's heart valve disease, which also I want to talk something about today. So heart valve disease also happens often. What is it? So the heart has 4 valves, and when one of the valves, its job is to let the blood flow in one direction, and due to many reasons, it can be diseased and not work like it's supposed to. In this particular case, this valve is called the mitral valve, and sometimes it can snap and let blood flow backwards, which is not good. And so for people who don't understand English or do not get this, auf Deutsch kurz zusammengefasst, wenn die Klappe nicht hält, kann es ein Problem geben. Sometimes science leads to very general truths. The next one is it is complicated to fix. You know, it's a complicated surgery. Sometimes it's easier to replace it than fix it. And like most complicated things, often the solution is to put a ring on it. And surgeons also do this. They put a ring on it and hope things go back to normal. So what they try to do is push the walls together so it can close again and avoid blood to flow back. And this surgery is called mitral valve repair. And like often in life, it's really hard to get it right the first time. Somebody felt that. So what they need to do is they also need to practice for it. It has a really high learning curve. And here, it's not just that they put a ring on it, but they also try to fix the cords that were broken by putting artificial ones. And the way they can practice, of course, I'm not saying that at Heidelberg they practice on patients. Nowhere they do that. But what we can do here in our lab is take a scan of the valve, and then we 3D print it to make a replica out of silicon. And here we can make a heart valve that looks a lot like the deceased patient's valve. And then surgeons can now practice stitching on it and implanting a ring on it. And this valve is then put into a tube where the surgeons feel closer to what they do in the operation room, where they have a limited opening to see the valve. And this surgery is complex not just because how difficult it is to perform, but also, again, like most things, size matters. Here I mean ring size. Of course, I mean ring size of the mitral wall, what they implant on the mitral wall. So the size of the ring determines if the valve can close properly. It's one of the major factors that determine how successful the surgery is. And I did what everybody does to ask how you can determine this ring size. I went and asked ChatGPT, and it had some ideas. It says, pretend to be a medieval knight, ask her for her finger, and use a string, and then make a grand show out of it. Clearly, this is a situation everybody can imagine, but in the of course, not this one. I mean, asking someone their ring size, but in the operation room, it is, you see a heart wall from a limited view, and it's really, you can't touch it, you can't put a string on it, so you need to, so this doesn't happen in the surgery. It's still a very difficult problem. In the operation room, the surgeons use tools where they can place and try out different sizes. But just to do it with the image that you see, just to understand the size is still a very difficult problem in the operation room. But in our surgical simulator, we have the option to use sensors to understand the wall better. Now, what I'm going to show you is a tool that we built in our lab, where you can mark points on the wall and using sensors, understand how the wall looks like in 3 dimensions, which is what you see. And why is this useful? It's because we can now make measurements so that we can see how big the wall is, and then what we can also do is try to overlay different ring sizes and then see which one fits best. So this is to support the decision-making of the surgeon with more detailed information. And previously, I told you that the surgeon stitches on the wall. What we can also do is try to detect these points and use this to make further visualizations that are helpful to them. And you can think of this similar to Snapchat or Instagram filters that most of you use, which can apply different filters on your face that look like this. How they actually work is they detect different points on your face and then use it to orient the filters. And they usually learn on millions of images. So in surgery, we don't have as many images, which is still a huge limitation for us. But the methods keep getting better where we can help surgeons. It's actually amazing how what most people think is stupid technology for young people can also save lives. Yeah, so I'll end my talk on this note. So this was research done at the University Hospital and as part of a wonderful, wonderful team, some of whom are also here. So thank you.
Der letzte Start am heutigen Abend, Lalith Sharan. So we should be able to see some of these people in the audience right now. Wo sind denn die Leute aus Laliths Forschungsgruppe?
Hi.
That's not some of them, that's one.
Oops. I was told that more people are going to come, but...
Wo sind die anderen? Hä? Bist du alleine? Oh, no, you have... You know, we are sold out. I guess I didn't get any tickets because we were sold out.
Sure, that's the reason, yeah.
So you were all supposed to wear blue on that day. Oh, you're wearing the same shirt.
Yeah, I thought, you know, it's easier to...
Sorry, it's getting more and more embarrassing now. It's a beautiful shirt.
Thanks.
Wie hat das für dich funktioniert? Hast du verstanden, was mit den Herzklappen los ist? Und das ist krass, ne? So, ja, mega. Und Snapchat, das kann man jetzt selber zu Hause vielleicht. No. How do you make an imprint of the wall in the first place?
So we use the ultrasound that is made for diagnosing the patient. So it's a 3D ultrasound, and someone segments it, and then we make a mold, inject silicone into it, and then you get it.
So the same like when we're scanning baby bellies. Okay, ein Ultraschallbild wird gemacht. Okay, und dann kann man diesen. Wow. So, but and then the operators, they wear like glasses that they use to see the points on where to stitch.
That is one way to do it. So what I showed you, the tool that we developed, sometimes the tool already has a feature where they can see which points have been stitched. Of course, we haven't taken this to the operation room yet because we can't use sensors there. But
when will it be?
We were thinking in 2 weeks, but no, just kidding. No,
I was getting excited. Like,
no,
okay.
So right now, most of the research we do is data that we record from the operation room. So we still have to validate that it works well in the operation room because most of these methods work based on how much data you have and.
But that's the future. Computer-assisted operations will be the future. Okay. Yes. Okay, Leute, habt ihr noch Fragen an Lalith? Kannst es deinen Kollegen alles fragen, was er dir sonst nicht sagt? Nicht? Alle haben... Da, doch, eine Hand. Ja, wie kriegt man den Ring dahin? How do you get the valve to the heart? Because
the ring, you mean the ring under the heart? So
you have to cut it all open?
No, so previously it used to be done where you open. It used to be an open heart surgery, but now we make a limited, like a small incision on the side, and then there's an endoscope, and the instruments also go via the side. So it's a small opening, and that's why they use an endoscope, which is nothing but a camera where they can see it in a bigger way.
Can you do anything with endoscopes these days? Is it actually necessary to cut open anyone anymore?
Yes, in cases where for some reasons they can't reach it easily, or there are some complications because the patient is too old, then they would need to operate like open heart.
Okay.
But the preferred way is to do this because the patient recovers more easily.
Yeah. It's less scary than to use a saw and like. Okay. Thank you for the question. Thank you for your presentation. Und wir machen nochmal einen großen Applaus für Lalith Sharan, den letzten Start am heutigen Abend. Thank you.